Colon cancer or colorectal cancer is a cancer of the large intestine. So our intestine has got two major divisions, that is the small intestine and the large intestine. So colon cancer or colorectal is the one that happens in the large bowel. It can be in several locations, starting from the beginning to the end of the bowel. Causes of colon cancer, again, any kinds of cancer or these kinds of problems actually have multifactorial causes. Like there are several factors. There are certain colorectal cancers that run in families, like there are genetic predisposition for that. And there are sporadic cancers also, like there is no one in the family but still I get a cancer, which is the actually the higher percentage. So in causes, it is said that low fiber in the diet, people who have chronic constipation, worse lifestyle, who eat non-vegetarian diet more, there are these kinds of factors actually contribute to the development of a cancer. Important symptoms would be actually that depends on at which location of the large bowel the cancer is. For left-sided cancers, or in general terms, if the tumor is located near to the opening of the anus, like lower down, so that can present with bleeding, like there can be fresh bleed or blood mixed with stool, these kinds of symptoms. And for the tumors located more proximally or located earlier, that is, they can present with anemia or decreased blood in the body, I mean level of hemoglobin in the body, because these tumors tend to bleed continuously, and they can present with low hemoglobin and therefore weakness. Actually, we find a lot of patients whom actually they present with low hemoglobin. We do several other tests, we don't find anything, but on a colonoscopy we find that they have got a tumor. Colon cancer for diagnosis, actually, again, patients can present to us in several forms. Like I told already, that patients can present with anemia, get investigated, low hemoglobin, that is, get investigated, and they incidentally we see that there is a tumor in the colon. And otherwise, some people have problems with their stool defecation, that is, for cancers which are lower down, they obstruct the passage of the stool, and there are several symptoms. For a diagnosis, we actually take a history, then we go for investigations like CT scan of the abdomen and pelvis, and also a colonoscopy, which is a test by which there is a camera, there is a scope that is put through the anus. It goes up and looks at the whole large intestine. Treatment of colorectal cancer, again, in any form of cancer, it encompasses three basic forms of treatment that all cancers have, that is surgery, chemotherapy, and radiotherapy. Basically, the idea is, if the tumor is resectable, that is, surgery can be done in such kind of a tumor. So we take it out, and then it goes for a biopsy. Then we see how much of lymph nodes are involved or something, and then further treatments are planned according to that, like chemotherapy or something. And there are certain tumors which have grown big, which initially are not, surgery is not feasible for them. There is something called a neoadjuvant treatment, in which they get chemo and radiation prior to the surgery. The tumor size shrinks down, then they are taken for surgery. And we again see if the patient needs some adjuvant treatment, that is, some treatment after surgery or not. After all this, there are follow-up session. I mean, once all this is done, the primary treatment is done, then the patient can remain on follow-up with colonoscopy and other investigations. Complications of colon cancer can range from, like I was telling, that if it is on the left side of the colon, that is nearer to the ear, they present with obstruction or complete blockage of the passage of the stool. So these patients can present to us with distended abdomen in an emergency, like that. And apart from that, patients who have right-sided colon cancers, they can present with weakness due to low hemoglobin in their system. And obviously, There are other complications like loss of blood can lead to severely low hemoglobin. Basically, it can, if it is not treated, the cancer can spread to other parts of the body. Then they can have several other complications like jaundice. If it spreads to the liver, then it can spread to the bones, causing fractures. There are whole lot of problems can arise. Like in any forms of cancer, colon cancer can also be prevented by lifestyle changes. It was said that including aspirin was in the day-to-day diet, or along with, as a medication along with diet, that can reduce chances of colon cancer. That has also been tried in genetic forms of cancer. But in general, people can include fiber in their diet, see that they remain hydrated well, take good amount of water, and see that they are not very constipated, or they are having altered bowel habits, like that. So maintaining a good lifestyle and a good gut health, I would say, that helps in prevention. The survival rate, actually, it depends on the stage that it is detected. Thankfully, it is one kind of a cancer. It is usually detected a little bit earlier than other organ cancers like pancreas and all. So if it is detected in the early stage, like stage 1 or something, then colon cancers can also be curable. Again, it depends on the histology, that is the pathological type the cancer is. There are various things like well differentiated, moderately differentiated, like that. So if it is that, then it can be curable. And it is something like end stage kind of a situation, then we have no options but for palliative treatment. Then the prognosis is poor. But considering all organs in the body, colon cancer would be rated as an average type of cancer. It is not very bad, but also it is not very good, like cancer like thyroid and all. Thyroid cancer is a very papillary thyroid cancer is a very good form of cancer. So this basically depends on the histological type or pathological type that it is.